Wait a minute. This is the year 2079, so in 54 years Thank you for watching the video. This is YouTube Medical University. I'm very upset right now, because as you saw at the beginning, this app has just told me my lifespan. It's an app called Death Clock. This is the recently popular app that predicts your lifespan. Don't you want to know your lifespan? I think many people would say they don't. But what if you could find out using the latest technology? And what if you could even change that future? So this time, starting with this app called Death Clock, we're going to thoroughly examine your future health risks using the latest tests. So this time we're going to take a closer look at the life expectancy prediction app I just introduced. In addition to Death Clock, including Death Clock, I want to actually test out 3 health prediction tools, including the latest checkups. So, with that said, the one who just declared my life expectancy earlier, I'm sure you're all curious about what kind of app this Death Clock is. Maybe it even made you a little scared. Let's take a closer look. In this app, you enter your age, lifestyle habits, and health condition. Then, the artificial intelligence analyzes data from millions of people and calculates your life expectancy. Is this really true? Honestly, as a doctor, I still have some doubts. Seeing is believing. I'd like to actually use this app to calculate my own life expectancy. I'm a little scared, but for everyone's sake, I'll give it a try. First I'll enter my age and gender. Then I'll be asked detailed questions like whether I smoke and how many hours I sleep. I drink about 1 to 7 glasses of alcohol weekly, and I'm embarrassed about my exercise habits. I've been too busy to exercise much lately. And as for my sleep, I get more than 7 hours a night only a few times a week, I think. As for stress, because of my job, I think it's about this much. Just like this, I'll be answering various questions in the app. Honestly, I thought they asked very detailed questions. Now then, will this really tell me my lifespan? Here it is. My result, my lifespan is Friday, April 21st, 2079. That's right, it's specific down to the exact date and even the number of days. At 84 years old, my remaining lifespan is like a time clock. It now says I have 54 years, 6 days and 8 hours left. My lifespan is shrinking every moment. What do you all think about this result, the lifespan that this Death Clock has shown me? I'm sure all of you have various thoughts about it. However, to be honest, from a medical point of view, it's really just... I have to say that the results of this app are really just for entertainment purposes. There is no data showing that if you use this app to measure your lifespan, it will actually turn out that way. Please don't take the results of this app at face value and get depressed. So next, I'll introduce some tools that can predict your future a bit more specifically. Here's the second tool. This is the web version of Korisu-kun. Korisu-kun. Have you heard of it? This is a tool created by the Japan Atherosclerosis Society for atherosclerotic diseases. It's a tool for predicting disease onset. With Korisu-kun, atherosclerosis. Diseases caused by the hardening of blood vessels. In other words, myocardial infarction and cerebral infarction. It's a tool that predicts the risk of such conditions based on certain medical evidence. Unlike the Death Clock I mentioned earlier, this is a prediction tool that uses reliable data. Specifically, it uses factors like age, gender, blood pressure, and cholesterol levels. You enter details like smoking status or possible diabetes. These are values you can fill in if you've had a general health checkup. Entering this information lets you estimate your 10-year risk for myocardial or cerebral infarction. It will calculate the probability for you. Now let's get started. Enter your gender, indicate whether you have a smoking habit, and then enter your blood pressure. And then there's impaired glucose tolerance, which means whether or not diabetes is suspected. You enter whether your blood sugar level when you're hungry is normal or not. Then, if you enter your cholesterol value, the calculation can be done. The results are out. My risk of developing arteriosclerotic disease within 10 years, surprisingly, the probability was 11%. Compared to people of the same age and gender with the lowest risk, my risk was actually 11 times higher. That was the result. since it's almost the same as the lowest risk group. So for now, does that mean I'm low risk? With Korisu-kun like this, you can get a more concrete understanding of your risk. Everyone, you shouldn't feel too relieved just yet. Korisu-kun also has its limitations. Korisu-kun only calculates the risk of arteriosclerotic diseases, meaning heart attacks and strokes. However, what threatens our health isn't limited to those diseases, right? For example, cancer, Japan's leading cause of death, and dementia. With Japan now a super aging society, anyone could develop these diseases. According to the 2024 white paper on the aging society, especially dementia, it is said that by 2025, 1 in 8 elderly people will have dementia. And dementia is treatable, except for treatable dementia types. Once it develops, current medicine struggles to provide fundamental treatment. It's considered an irreversible disease, and that's not all. Lifestyle-related diseases increase the risk of developing serious illnesses in the future. In this Korisu-kun, although online is convenient, it can't predict risks for diseases besides myocardial or cerebral infarction. So let me introduce the third latest test. This is the one I actually took myself. By drawing blood, it allows for future prediction of a wider range of diseases. Let me introduce Fornes, a testing service. There are mainly 3 key points. Here is the first point. It can detect hidden health risks that can't be found through a regular health checkup. Fornes is with one blood sample, it can measure around 7,000 proteins for the first time worldwide. And then, by using NEC Group's artificial intelligence and big data analysis, the results can actually reveal the risks of various future diseases in numerical values. It can predict the risk of developing myocardial infarction or stroke, including the risk of recurrence. And that's not all. This new test can also predict the risk of serious diseases such as dementia, lung cancer, and kidney failure. Moreover, what you need for this Fornes visuals is a single blood draw is all you need. It's gentle on your body and can predict disease risk 4 to 20 years in advance. Fornes Visuals. This service is different from conventional tests. I truly believe this is a new service that supports future health management. So, how exactly does it work? I'll explain the technical aspects as simply as possible. The test is very simple. At a medical facility, about 5 cc of blood is drawn. That's all. There are no special restrictions on eating or drinking alcohol. This test is sent to the Fornes Life laboratory, where a detailed analysis is performed. The test results are provided through the physician at the medical institution. The key point is the technology that analyzes about 7,000 types of proteins. At Fornes Visuals, what is the SOMAMA? Uses artificial nucleic acids to analyze about 7,000 types of proteins in the blood all at once. They're using the world's first technology to do this. The amazing thing about this SOMAMA technology is that it can use artificial nucleic acids called aptamers that attach to each of the 7,000 types of proteins. Previously, only a few hundred types could be measured, and measurement accuracy was also limited. However, with this new technology, we can now measure about 7,000 types of proteins all at once and with very high accuracy. According to Fornes Life, they have received cooperation from biobanks around the world. They have collected blood samples continuously for over 20 years from hundreds of thousands of people, and using the technology to analyze 7,000 types of proteins, they have conducted research and development. In that research, they compared and analyzed the protein composition of the blood of people who became ill and those who did not. By doing so, they were able to classify people into groups with higher and lower risk of getting sick, making it possible to predict future risks. These research results were published in an international academic journal. It has also been published in Journal of the American Medical Association and Alzheimer's and Dementia. That means this technology is recognized worldwide. And the second point is that by knowing your future health risks, the quality of your life planning improves. Traditional tests were used to check whether a disease had developed or not, but this Fornes predicts the risk of developing certain diseases in the future as a numerical value. In other words, instead of whether you have a disease or not, at a stage before you get sick, it tells you in numbers what percentage chance you have of getting this disease in the future. By knowing the probability before you get sick and taking measures, you can avoid getting sick. It's a new type of test with a concept aimed at the future. Nowadays, 20% of the causes of illness are genetic, and the remaining 80% are due to daily. It is known that they are caused by lifestyle habits. In other words, if you can review your lifestyle habits, you can also change your risk of illness. Serious lifestyle-related diseases like myocardial infarction, cerebral infarction, and cancer can be life-threatening. Treatment can involve surgery or anti-cancer drugs, placing a heavy burden on your mind, body, and finances. That's why it's crucial to act before the disease develops, not just rely on early detection. It's important to know how much risk you have and take preventive measures. This test is not covered by insurance, but considering that you can get so much information at once and learn about your risk of developing diseases, which allows you to take preventive measures, I believe it's a worthwhile investment for the future. Also, since there is a campaign going on right now, I would appreciate it if you could check the details from the description box. Now here is the third and final key point of this test, tailored to each individual. You will learn specific ways to improve your lifestyle habits. I actually took the test myself, as I mentioned earlier. It was really quick, just a simple blood test and it was over. After taking the test, I discovered some new things about my own health risks. For example, in my case, I have a risk of developing dementia within the next 20 years. The risk is 4%. The risk of having a heart attack within 4 years is 3%. The risk of developing lung cancer within 5 years is 0.2%. The risk of developing chronic kidney failure within 4 years is 0.19 times the average. I was relieved to learn that the risk of these diseases is generally low. However, in the tests that check your current physical condition, there was a suspicion of abnormal glucose metabolism, called impaired glucose tolerance, which is the function that keeps your blood sugar levels normal. The results showed that your cardiorespiratory endurance, which is a measure of physical fitness, was lower compared to others in your age group. When I first saw these results, I usually think of myself as a physician who, although I advised patients on nutrition and exercise, I realized I had not been managing myself well. Even as a physician, I'm still human. Many people don't have perfect habits. I was a bit disappointed in myself. This service doesn't end here. The aftercare following the Fornes visuals examination was very thorough, so I felt relieved. That's because with the Fornes visuals examination, it's not just about taking the test, and that's it. They are a qualified public health nurse. The concierge listened to each person's lifestyle and suggested ways to improve daily habits that seem sustainable, saying, "Wouldn't this be something you could keep up with?" Many people may not know how to improve after a regular health checkup. This service also offers peace of mind in that area. In my case, because of my profession, I already knew what and how I should improve. They listened to my lifestyle, helped me organize it, and gave me suggestions tailored to each individual. In my case, I walk my dog in the morning, so they suggested I increase that time. When I come home from work, I hold my child, and while holding them, I made a rule to do 30 squats, and by consulting with the public health nurse, I was able to firmly incorporate exercise habits into my daily life. Of course, this test alone cannot predict the risk of developing all diseases, and the results are only predictions. So, regular checkups and health screenings, just like before, are still very important. This service is meant to complement and supplement those. I think it will become a new option for more comprehensive health management. What did you think? At the very beginning, I mentioned a life expectancy prediction app. Starting with Desk Lock, I introduced Korisu-kun. Lastly, I introduced Fornes Visuals, a new testing service for future health management, as the third topic. Desk Lock is easy to use and fun as entertainment, but its basis is limited. And as for Korisu-kun, it's a very groundbreaking service for predicting future arteriosclerotic diseases, but the range and period it can predict are limited. Fornes Visuals requires a blood test, but is otherwise different from the others. I'd call it next generation healthcare, even though it's private medical care. With just a single test, it measures about 7,000 types of proteins and uses artificial intelligence big data analysis to predict the risk of future diseases. It can also predict risks for diseases affecting Japanese people, including dementia, heart attack, stroke, lung cancer, and kidney failure. It covers many major diseases, unlike conventional testing services. This is clearly a new approach, and I believe this testing service will benefit many people's health management in the future. As a doctor, I strongly hope that this will ultimately contribute to the advancement of healthcare in Japan. However, I think some of you listening to this may be afraid to know your own future risk of developing diseases. However, by knowing your risk early, you can greatly change your future through your own actions. Fornes Visuals is one option for that. I hope this video will give you an opportunity to think about your own health management. I would be glad if this could be an opportunity for you. And if you're interested in this new service, Fornes Visuals, please visit the Fornes Life website. Let's take the first step together today for your future health. Thank you very much for watching until the end. I would be happy if this video can be of any help to you in managing your health and for your future well-being. I'd love to hear your thoughts or experiences with the app I introduced today. If you have any results or feedback, please let me know in the comments section. I think it will be helpful for others as well. And if you like this video, please give it a thumbs up. I'd appreciate it if you subscribe so you don't miss new videos. At YouTube Medical University, we will continue to share easy-to-understand videos from a doctor's perspective that can help you become healthier starting tomorrow. Well then, I'll see you in the next video. Thank you very much.